So today we're looking at Dr. Korikov and his practice, Advantage Healthcare of Spartanburg. That's down in Spartanburg, South Carolina. And our info, it all comes from excerpts from the practice's own website that a listener sent over. Our mission today, basically, figure out what these website bits tell us about Dr. Korikov's approach, what the site says he treats, and, why someone might choose him based on this material. Just getting you the facts from the source. Okay, let's unpack this.
All right. So looking through this website material, the main thing they seem to push about Dr. Korikov's approach is this idea of combining, medical expertise with advanced chiropractic techniques. That's the phrase they use. And the goal they state right on the site is achieving exceptional patient recovery outcomes. So yeah, that blend seems key to how they present themselves.
Right, that combination. And the website seems to connect that directly to the kind of problems they say he handles. The source material flags, several main areas. Headaches and migraines is one. Then neck and spine injuries, nerve pain, and also chronic conditions. It's pretty broad.
Yeah, it covers a lot.
So let's dig into the headaches and migraines part first. How does the website describe his approach there? It sounds quite specific.
It does. They detail the specialized protocol. It starts with a comprehensive neurological assessment.
Okay, looking at the nerves.
Exactly. Then precise cervical adjustments. So very targeted neck adjustments.
Makes sense for headaches.
Right. And they also list trigger point therapy, working on those muscle knots. Plus, guidance on lifestyle changes and, importantly, strategies for long-term prevention, not just quick fixes, according to the site anyway.
Okay. So a multi-step approach described there. What about neck and spine injuries? The site mentions his extensive medical background being relevant here.
Yes, they do emphasize that. The source suggests this background informs how he handles these injuries, and they list quite a range: whiplash injuries, and they specifically call out car accidents as a cause.
Okay.
Also, sports trauma, work-related injuries, both acute and chronic neck pain, and even what they term complex spinal conditions.
So the website really positions his approach as suited for both sudden trauma and ongoing spinal issues.
That's the picture they paint, yes.
And then there's nerve pain, that awful tingling or shooting pain some people get. The source says he uses, state-of-the-art diagnostic tools?
Yeah, that's the phrase, to find and treat nerve compression. And they mentioned interpreting advanced imaging.
Like X-rays or MRIs, presumably?
Presumably, yeah.
Okay.
Looking closely at those. Then, targeted spinal adjustments, again, likely to ease pressure on the nerve.
Okay.
They also list neuromobilization techniques.
Which sounds like ways to help the nerves move better.
That's likely the idea, yes, helping them glide more freely. And then custom exercise programs and progressive rehabilitation protocols.
Meaning the treatment builds up over time.
Seems like it. A step-by-step rehab plan, based on the website's description.
Gotcha. Okay, moving beyond specific injuries, the website also mentions chronic conditions. It says Dr. Korikov offers unique insights here.
That's right, unique insights. And the conditions listed under this umbrella are things like osteoarthritis, degenerative disc disease.
Now, wear and tear on the spinal disc.
Exactly.
Yeah.
Also just general chronic pain conditions, joint dysfunction, and other musculoskeletal disorders. What's kind of fascinating here is just the breadth of conditions mentioned, from acute injuries to these long-term chronic issues.
Yeah, it's a wide scope, they're claiming. The site also talks a lot about a patient-centered approach.
Yeah.
The focus seems to be on restoring movement and eliminating pain, and the elements they list for that. Let's see, evidence-based chiropractic methods, personalized adjustments tailored to the person.
Right, not one size fits all.
Therapeutic exercises, posture correction, and keeping track of progress, ongoing monitoring.
And that posture correction piece, they actually detail it further. They call it a scientific approach to posture correction.
Oh, interesting. What does that involve, according to the source?
Well, the site lists several steps. A digital posture assessment.
Using tech to analyze posture.
Seems like it.
Nah.
Then a spinal alignment evaluation, creating custom correction plans for the individual.
Okay.
Ergonomic counseling, so advice on your workspace, maybe how you sit or stand.
Practical stuff.
Yeah. And again, progress tracking. It sounds quite structured the way they describe it on the website. This raises an important question, maybe for you listening. Why might this kind of detailed approach to something like posture matter? Does that level of detail resonate?
Good question. The website also very clearly gives reasons why someone might choose Dr. Korikov. It points to his credentials and experience.
Right.
It mentions his chiropractic doctor degree, the DC. Also, advanced chiropractic certification, years of specialized experience,
Hmm.
a commitment to continued education, which is always good to see, and a big focus on patient education, helping people understand their own condition.
Yeah, empowering the patient seems to be the idea.
And they include a patient testimonial, too, from Robert Erickson. Let me read what the site quotes him saying. Dr. Korikov's unique medical background made all the difference in my treatment. His understanding of both traditional medicine and chiropractic care provided me with the recovery solution I needed.
So that quote really reinforces that core message. They started with a blend of medical and chiropractic perspectives.
Exactly. It ties it all together from that point of view.
And just covering all the bases from the source material, they do provide the practical contact info, if this sounds interesting to you. The phone number listed is 864-574-6840.
Okay, 864-574-6840.
The address, 1205 John B. White Sr. BLVD, Spartanburg, South Carolina. Zip code 2930 3929.
Got it.
And the service area mentioned includes Spartanburg itself and nearby places like Boiling Springs, Duncan, Greer, Lyman, and more.
So the surrounding communities, too.
Correct. And finally, the hours listed on the site. Monday, Tuesday, Thursday, they say 7:30 a.m. to 7:30 d.m.
Long days.
Seems so. Wednesday and Friday are shorter, 7:30 a.m. to 1:40 p.m., and then closed Saturday and Sunday.
Okay, good practical info there.
Yeah. So if we, connect this all back, try to see the bigger picture painted by these website excerpts. It really describes a practice that highlights this integration of healthcare approaches, claims to treat a really wide spectrum of issues, pain, injury, chronic stuff, and emphasizes detailed assessment and personalized plans, all aimed, they say, at patient recovery.
Right. So what does this all mean for you listening? We've done this deep dive into these website excerpts, right? We've looked at Dr. Korikov's stated approach, the blend they talk about, the range of conditions the source says he treats, and those specific techniques and assessments mentioned. So as you consider your own health situation, or maybe you're thinking about finding care, how does understanding the specific approach, just based on their website's description, how does that inform your own thoughts?
That's the key question. And maybe one final thought to chew on, based only on this source material. The website repeatedly emphasizes combining that medical expertise with chiropractic care. It also highlights specific tools, advanced imaging interpretation, digital posture assessment. So maybe think about this. How does reading descriptions like this, where a provider really points out their broad background or specific diagnostic methods, how does that shape what you look for? When you're seeking help for pain or just trying to improve your wellness, what value do you place on those kinds of stated claims or details from a practice?
Something to consider.